Hi, good evening. We are here at the 36th ECNP Congress in Barcelona. We're here with thousands of participants, more than last year, and with many online attending participants as well. My name is Ilse Graat. I'm a member of the Early Career Advisory Panel of the ECNP. And next to me are three lovely guests who I will talk to today about the highlights and the coming highlights of the Congress. Next to me is Marin Jukic. He is an assistant professor at the University of Belgrade, Pharmacy School in Serbia, and a senior scientist at the Karolinska Institute in Sweden. The group of Marin Jukic is working on the field of biological psychiatry and neuropsychopharmacology, and it focuses on both preclinical and clinical research. Next to him is Francesca Cirulli. She's a research director at the Center for Behavioral Sciences and Mental Health at the Istituto Superiore di Sanità in Rome, Italy. And her research investigates the role of lifestyle, dietary and social factors in determining stress vulnerability and resilience and the molecular and cellular mechanisms underlying it. And she's currently investigating how developmental stressors such as high-fat diet or psychosocial stress can negatively affect brain development and behavior. And she's also a chair-elect of the ALBA network, a network of leading scientists aiming to promote equality and diversity in brain sciences. Welcome as well. And next to her is Sarah Kittel-Schneider. She's a vice director of the Department of Psychiatry, Psychotherapy and Psychosomatic Medicine at the University Hospital of Würzburg in Germany. And she's also the section head of the Developmental Psychiatry unit. And her clinical aim is to improve transition of patients from child and adolescent psychiatry to adult psychiatry, as well to improve the treatment of mothers and fathers with mental disorders. And her research focus is on the neurobiological and genetic basis of affective disorders and ADHD. And in her lab, molecular biology methods are used to investigate fluid biomarkers for differential diagnosis and prediction.
It's all right. Just I relocated to Ireland recently, so I'm now chair of psychiatry at the Cork University.
Oh, we have outdated information.
But the rest is totally fine and correct.
Is it still the same?
It's still the same. No,
good.
just I'm working together now with John Crane at the APC Microbiome and leading the department of psychiatry.
Lovely. He's also a guest of the ECNP Daily on this Tuesday.
But it's very fresh, so
yes.
no problem at all. I'm just updating.
That's good. Yes. So, how are you finding the Congress up till now?
Exciting.
Yes.
Full of many things. Really difficult to choose.
Yes. Yeah. How do you like? Probably you all have a really full program with a lot of. Of course, sessions you want to attend, but also obligations. Like, how do you manage? How do you prepare?
Prepare.
Yes, yeah, prepare.
Yeah, I had to study, really.
Yes.
I mean,
yeah,
I spent my afternoon yesterday looking at the program and trying to, make a little bit of a path between many things. And I know that I can also look back at what I missed. So that's really good.
Yes, yeah, that's true. And
yeah,
for you,
very
Marin?
nice. It's very nice when you can actually attend physically if you're already here. So that's very advantageous. But I mean, I guess that the biggest challenge is to really make the plan. I mean, of the activities and to define your musts and to leave a little bit of space because it's easily packed and your actually brain can be occupied at one point so that you are basically after several sessions in a state that you cannot absorb anymore. So it's also important to give yourself a little bit of a break here and there from science, like during the program.
Yeah, some time to process.
To relax, to consolidate. We learned about memory and engrams today, so like there is this window of desensitization, which is, I guess, important.
Yes, that's true. Yes. And did you attend the keynote lecture today?
Yeah, I did, and Gina Jocelyn gave a very wonderful lecture, and I was really impressed because it's also really basic neuroscience, but she explained it in a very understandable way, And I really like to hear about the engrams and what kind of neurons those are and what kind of specificities they have and how those processes are also very context dependent. That was kind of, I mean, it's not from a clinician point of view, you kind of know it. But on the other hand, it's really cool to see that they figured out the cellular and molecular mechanism of this, what we really see in the patients, for example. And that is really true not only for fear-associated memory, but also reward memory. So that was really really cool. And I liked her statement that she's not only a woman in science, a very successful woman, but she's also one of the First Nations of Canada. And I wouldn't know that. And I think that is also a very important thing to mention it if you were like a minority or if you're First Nations, because they're very rare in science.
Yes.
So I really like that.
She also hosted the ALBA session, the ALBA network session. She also talked there. So it's good that she, makes highlights the importance.
I liked a lot actually she was very bold, because she showed the slide where she showed how few women Nobel Prize, there have been, and also I like the fact that she said, I'm in a position where I can really shut out about certain things. Being a minority, for example, but also being a woman, and showing, she was very open towards showing how, she was delivering her baby when the science paper came out, and she couldn't actually give an interview. I think this is really good, because it tells everybody that we are human beings, and we have, difficulties, and this makes us all feel better, I think.
Yes, it's the reality of working as a woman in science.
Yeah. So I'm really glad, and I'm really sorry that I missed the ALBA session, but I know I can look at it again still, and I'm sure that everybody knows what ALBA is, and the network that's been growing since 2018 to now being 1,500 people. So I think 1,500 members is really a very big number.
Yes, growing fast.
Yes,
and they also have a lot of like the ECNP, but also FENS, many big organizations that they work together with.
Yeah. So I'm really glad actually that ECNP hosted this session. I think it's really good.
Definitely, yes. And Marin, you are chairing the Brain Prize lecture on Tuesday morning, 10:05.
Exactly. And I mean, as you can all probably read from the abstract, this is basically this is one of such sessions which illustrates what ECNP is all about. And it's about mechanistic understanding of phenomenon, which is very important for neuroscience and psychiatry and clinics in general, and then going really in depth to the mechanism, and then going all the way to actually the treatment, because we have witnessed really the advancement of treatment of migraine, then with monoclonal antibodies, also with new concepts, and this really materialized in something that helped the patient. And we can only hope really that these types of examples will basically be more apparent in other diseases which might be or might not be more complex, such as psychosis or depression, and such phenotypes. When they are understood really in depth, I guess that that everything else will follow.
Yes. Interesting. So something
highly
to look
recommend.
forward to. Yes, and the speaker is Peter Godsby.
Exactly.
He's the winner of the 2021 lecture.
Exactly.
Brain Prize
is a very prestigious.
Yes.
There is no Nobel Prize for neuroscience, but the Brain Prize is as good as equivalent as it gets.
A big prize.
Exactly.
And maybe also good to mention that the 2023 Brain Prize winner, Aaron Schumann, he will present at next year's Congress. So also something to look forward to for next year. Yes, yeah. And Francesca, you are also moderating a session, right? educational update session.
Yeah, I'm really, really glad that ECNP is giving a lot of space to this, lifestyle and new sessions. And I'm really excited about the one that I will share tomorrow, because we are going to talk about, are we ready for green therapies? Now, we know that being, in a park or walking is good for us. But what we really need to do now is to go from some, superficial knowledge to really act and do something, and prescribing. And so I like to think that in the future we will be prescribing, walking or doing exercise or a certain diet, like we prescribe drugs.
Yes.
So, but there is still a big leap, between this and really get into clinical practice. But it is by sessions like this that we can, make little steps and get to that. So I'm really excited.
Yes.
And there will be two very, very nice people, actually. One is Matilda van den Bosch. She's an epidemiologist that works here in Barcelona, and she's really a leader in the field. And the other one is the Botkin.
Yeah, Claudie Botkin.
Claudie Botkin, and she's also a very well-known woman scientist that works on, for example, trying to understand how living in a city rather than living, in the countryside is going to affect our brain.
Yes.
I think these are really important
Yes.
things.
Yeah.
We have to really, think about it.
Yes, yeah, sounds very interesting. And very important for clinicians to be aware of these things, to tell their
Absolutely.
patients. Yeah,
Absolutely.
Yeah.
Looking at, not only at the mental illness, but also at the person and where that person lives and which conditions and, So I think this is really enriching
yeah,
clinical practice.
yeah, interesting. Yeah. And Sarah, you are also chairing a session, right? The S13 session on Monday about perinatal mental health.
Yeah,
Yes.
I'm looking forward to that, and I'm really glad that we got it together. It's about the psychosocial, but also neurobiological mechanisms, and then also drug treatment and pregnancy and lactation and breastfeeding. Because on the one hand, there is still much less known about the risk factors and the pathomechanisms in perinatal mental disorders. And on the other hand, there's still a lot of insecurity about treating pregnant women, for example, or breastfeeding women with pharmacological medication. And even if we experts, it's for us it's a bit boring to tell them it's okay, you can give antidepressants, no problem at all, but still it's not done in clinical practice. And I've always, also only 2 weeks ago, a young bipolar woman approached me and said, okay, she was told that she couldn't take any medication even if she's severely depressed in her pregnancy. And this is something we still, need to work on and educate the public. But on the other hand, we really need to look into how can we also reduce the transgeneration transmission of mental disorders from the parents to the children. And this is also something that goes in the direction of Francesca's work, to see how can we, for example, educate women in pregnancy to have a healthier lifestyle, to eat better diets, because it could directly affect the children's mental health also. And I think a lot of research we still need to do about this. But I think we're getting there, and we're going in the right direction.
Yes, yeah. So it's about during pregnancy, how women can live healthy, but also about clinicians maybe being too hesitant prescribing neuropsychopharmacology during pregnancy and breastfeeding.
Yeah, if there's an acute episode. But and also I think we can do a lot of preventing mental disorders in peripartum. But we need to we need to know more about that, and we also really need to then educate the practitioners and also the patients. And
Well, in this sense, lifestyle psychiatry is really going to help this type of situations, right? Like a pregnant woman, if we can find, for example, that a diet can substitute for the other type of treatments, then it becomes really
because that will
important.
even if you say you can give antidepressants in severe depression and that there's no long-term harm for the baby, but the woman, the preference of the woman would be more into, for example, nutritional treatments than taking an antidepressant. So it's very important to maybe that we have like alternatives in the future. And there are first hints. We saw that we are shortly before publishing the European guidelines for peripartum depression with an EU cost action RISA PPD. And there we found first hints, for example, for using PUVAs, like omega fatty acids, for preventing and also treating peripartum depression. So I think we're going in the right direction, but we need more data, more evidence to back that up. And also see, and that is what I saw today, that it might not help every woman, because we might need to stratify the ones who have a higher inflammatory profile. And this is what in the session today, Lucille and Bernard were talking about, that anti-inflammatory treatments are only helpful for a subgroup of, for example, major depression patients. And I think that could be the same with preventing peripartum depression or treating peripartum depression, that we first need to find out who are those subgroups of patients we can help with those kinds of treatments.
Yeah, interesting. Well, sounds like a very broad session, but very interesting. Yeah. And what are other things that you are looking forward to, other sessions that you definitely want to attend?
Well, for example, there's a session tomorrow. There's a symposium about genetics in schizophrenia and bipolar disorder. I mean, those disorders which are, well, basically counted as neurodevelopmental disorder, which brings again the connection with the perinatal period. It's very fascinating. The genetic component is really humongous. I mean, its significance is really great within two of these diseases. And then we have Psychiatric GWAS Consortium and all these kind of efforts to understand what's really happening on the genetic frontier. And I guess that as the number of data grows, we will learn more, and we are always curious to see actually what's the newest gain of knowledge there in that regard, because we really expected, I mean, first they expected a lot from these studies. I mean, we thought that by this time and this number of patients in this cohort that we will explain the whole schizophrenia, that everything will be super clear. It ended up, well, as usually this kind of hype things ends up, but we are gaining knowledge slowly, and I'm really curious, for example, to see that.
I actually there is a session that I would be really interested in. I think there has been some also press release recently having to do with, I'm sure you know more about this, hormonal contraception and major depression. And so I think this is really a very relevant session.
Yeah, definitely, because I think that the data is not very consistent, but there is data now from the big, nice Scandinavian registries pointing also in direction of at least subgroups of women, being affected by that. And the thing is, usually if you go to your obstetrician or gynecologist and he will prescribe you contraceptives, he wouldn't explain to you that you need to see if your mood is getting low and you're getting depressive symptoms. Usually that is not something they would explain and tell you that there could be a side effect. So I think it's a very important topic, and all those like gender and sex differences and mental disorders, I think we really need to look more into that, because especially women are just explored and under investigated.
The recent years there's more attention for it, but we're not there yet, of course. And do you have any other session that you are?
There is another one actually on resilience. This is another topic that I'm really familiar with. So early in the morning, I would definitely recommend.
Yeah, good. Well, enough tips for the audience.
And don't forget the posters, of course.
And don't forget the posters,
don't forget the posters.
That you can also see online. So also for the people participating from home. Well, thank you very much for watching the ECNP Daily. Thank you very much for being here and for giving your advice. And we are here again tomorrow. So hope to see you then. Have a good Congress.